Hi guys, this video is about fluoroquinolone antibiotics and how it can affect your tendon health. So fluoroquinolones are a highly effective spectrum of drugs, wide spectrum antibiotic, which means it can be useful for loads of different organisms, but it affects tendons really negatively, causing Achilles Tendonitis, so not tendinopathy, acute inflammation of the Achilles, and also quite often a rupture of the Achilles tendon without even any tendonitis type symptoms beforehand. So at the moment, the current guidelines is stating that you should only use them in cases where you can't use any other antibiotics. In this video, we're going to look at the different types of fluoroquinolone antibiotics that you get. I have no idea if I'm even saying the word correctly, because you'll see in a minute how long it is to say. We're going to look at all the different types you get. We're going to look at why it affects your tendon so negatively and what the process is behind that. Then we're going to look at what a safe dosage is of that for your tendons. We're going to look at risk factors, that if you take it and you have other conditions or you do other activities or stuff, how that can increase your risk of a tendon injury. And then lastly, we're going to look at what you can do if you have to take these antibiotics to prevent or reduce the risk of your Achilles tendon becoming injured. My name is Marika. I'm one of the physiotherapists from treatmyachilles.com, where you can get online assessment as well as treatment for your Achilles injuries. So have a look at the link to our website is in the description of this video if you want to know more about that. So let's have a quick look at what different types of fluoroquinolones you get. So fluoroquinolones is the big name for all of these different types that you get, and they've all got slightly different functions to them. That's why they're different. Read that list. The most common one, it seems, that's prescribed in the USA is Cipro or ciprofloxacin. And remember, these are the medical names for them. They will be sold under different brand names, like Cipro, etc. So do read the label of your antibiotics that you get. Luckily in the UK, these are not prescribed as a first line of defence in the NHS. They're quite vigilant about this, but it seems from the comments on social media that it is quite commonly prescribed in the USA. So watch out for these. Excellent. So moving on from that, why do fluoroquinolones produce problems in your tendon? Well, the short answer is they mess with the collagen turnover of your tendons. Collagen is the main building block of tendons, and during normal life, we're forever replacing old cells or cells that's injured with new cells. It's a normal turnover process. Also, when we exercise, we get micro damage, body repairs the micro damage, and you're stronger for the next exercise bout. But because the fluoroquinolones affects this collagen turnover and it stops you from forming new collagen cells, you now just get the breakdown and you don't get the recovery that's supposed to happen. It's also shown to sometimes cause a dramatic inflammatory response in tendons. So patients will describe a really hot, swollen, painful tendon that throbs. In other cases, you won't have any of those symptoms, and the tendon will just rupture all of a sudden because it weakens the tendon because of that collagen turnover that's not been happening. How long does it take to happen? For some patients, it happens within a couple of hours of taking the first tablet that they start actually complaining about the symptoms. Others will have no symptoms for 6 months and then suddenly rupture a tendon. So it just depends on your specific case. Is there something? Oh yes, I shouldn't forget. It can also affect cartilage and bones, and especially in children. So at the moment, the guidelines state that these antibiotics should be avoided at all costs for children. You should always try and use something else, unless it's life-threatening and you can't use anything else for it. So what is a safe dose for tendons? Well, actually what the research is showing, that where tendons are concerned, there isn't something like a safe dose. Like I said, some patients already experience symptoms within one tablet, taking one dose of it, within 2 hours of that, whilst others it can take up to 6 months for symptoms to show. So if you're taking this, you've got to take precautions to not load your tendon even more. If we think of risk factors for Achilles injury when you're on fluoroquinolones, everybody who uses them are at risk even up to 6 months after you've stopped using them. Now, if you do tendon loading sports, so where you use your tendons, especially the Achilles tendon, you're at a higher risk, because remember, when we do exercise, you get micro trauma in the tendons, the muscles, the bones, and that's good, that's normal, because that's how the body repairs it and rebuilds itself stronger. But now, because of the antibiotics, you can't rebuild your tendons as quickly or at all sometimes, and that can lead to ruptures. So if you're somebody who likes to run, I would say maybe consider substituting any running or jumping sports with rather going cycling and swimming for up to 6 months after taking your last tablet or last dose of these antibiotics. Then patients who were prescribed fluoroquinolone antibiotics at the same time as corticosteroids were 46%, let me just get that right, they had a 46-fold increased risk of Achilles tendon rupture than people who were only taking the antibiotics. So if you have to take fluoroquinolone antibiotics, it's really, really best not to combine that with corticosteroids. Of course, there will be medical cases where you can't avoid it, but your doctor has to really think about whether there's anything else that can be prescribed and whether it's really needed. Also, older patients seems to get these side effects more often in their tendons, and that does make sense, because for older people, their bodies recover much slower in any case. Their collagen turnover is already slower than a young person. So add on top of that fluoroquinolones, which stops the collagen creating new cells, then you get a cumulative effect. Also, patients with diabetes as well, or rheumatoid arthritis or gout or hypothyroidism, they seem to be at a greater risk of these bad symptoms as well. Now, what if you absolutely have to take these antibiotics and you can't get away from taking them? What do you do then? My first bit of advice would be keep your tendon loading activities and sports to a minimum. So don't do jumping activities or running activities unless you really have to do them, or do a tiny bit of them. But remember then, if you are going to continue running, you will need more recovering time between bouts of running, because your tendon will not recover from the exercise that quickly. You're much better off doing cycling or swimming for this period up to 6 months after you've taken your last dose. You may also benefit from taking supplements. There's some research out there to show that if you take supplements of either gelatin or hydrolyzed collagen in combination with vitamin C, that can have a positive effect on collagen turnover. I'll put a link to a video I've done on that in the description of this video as well, or link to it in this video. Just check if there's a little thingy that came up. Excellent. So let me know if you've got any questions. If you need more help with your Achilles injury, you're welcome to consult one of us online via video call, and the link to our website is in the description of this video if you want more information about that. Take care.